Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with our weekly podcast. I hope you guys, like me, are happy that the pandemic is over. I say that with a grain of salt, but I'm truly hopeful and things are looking up. Plus, it's about to be spring, so we're going to celebrate. Today, let's talk about a disease that I've been seeing a lot more of for some reason recently. It's Parkinson's disease. You all have seen it. You've been affected by it, probably with family members. But it turns out there's 50,000 new cases of Parkinson's in the United States every year. And speaking of COVID, I think we're going to see a lot more of Parkinson's in the future because of COVID-19. Parkinson's is a disease that's caused by loss of nerve cells in a particular part of your brain called the substantia nigra. And this is the main part of your brain that produces dopamine. Dopamine is it's a neurotransmitter. It's kind of been termed the reward neurotransmitter, but it's very important in movement. And that's what we usually talk about when we're talking about Parkinson's. It's a disease of movement, and then it can cause dementia and really cause a lot of problems. But anyway, so the dopamine acts as a messenger network between the brain and part of the neuron system that controls motor movement and coordinates body movements. So you get a loss of these nerve cells for one reason or another. They either die or they're damaged, and you start getting symptoms. Now, by the time you develop symptoms, it's estimated that over 80% of your dopamine is already gone. So this is a really slowly progressive disease, and there's no cure for it yet. I'm sure there will be someday, but it's one of those neurodegenerative diseases that we like to treat and maybe even prevent. Our thing in performance medicine is prevention. But anyway, so what happens is those movements become slow and abnormal. Your body gets stiff. It usually occurs a little bit more often in men than women. Usually the average age when you start having symptoms is 60. And it's estimated, I think, 3% of people over 80 will get it. Nobody really knows what the cause of it is. There may be a slight genetic component, especially to the earlier forms that come in earlier in life, but it's kind of rare. Probably 15% of it you could blame on genetics, and there's probably some weird gene or mutant gene that may predispose you to getting this. But remember, we're all walking around like a loaded gun. The environment pulls the trigger. So in most cases, it's environmental. And some things that have been postulated environmentally, of course, are pesticides and herbicides. Maybe lack of vitamins, especially vitamin D. We always circle around to vitamin D and how good it is for you. There's no scientist anywhere in the world that can dispute that vitamin D is actually good for many, many things in protecting you. So we're not really sure of the cause, and how do you diagnose it? It's mostly a clinical diagnosis. There's no blood test for it. An MRI will not show it on your brain scan. Usually they'll do an MRI to rule out other causes, and there is kind of a test that it's more of a SPECT scan that shows brain activity in the dopamine areas. So there is one that may kind of be helpful for that. It's not a normal test that you can get. So symptoms. These patients, they have a hard time moving. They get that wide space gait. They have a loss of expression in their face. They get depressed. They get constipated. They have a hard time sleeping. They can't concentrate. They fall a lot. They have a resting tremor. That sometimes is diagnostic. Loss of reflexes. They have this thing called cogwheeling rigidity that you can test them for. So rigidity and bradykinesia. Another interesting thing that most of them have a loss of smell, brain fog. But figure that loss of smell and think back to COVID, loss of smell. So they think there may be even a viral etiology to some Parkinson's diseases. In fact, they proved it. Even after the Spanish flu, they saw a lot of encephalitis, which probably more even than COVID-19. In other words, it got into the brain and caused inflammation. So they think there may be a viral etiology to some Parkinson's as well. And one of the things you think about is loss of smell that we saw with so many patients with COVID-19. And they're doing studies to kind of try to figure that out. They really need to do more autopsies on the brain to figure out how substantially it got into that area of the brain. I assume they will. They'll study that and maybe figure it out. So, if you have a prolonged loss of smell or taste from COVID-19, you may want to start thinking about doing some things that can maybe prevent Parkinson's disease. But anyway, so there's no real lab test, the imaging suspect for it. So there's no real cure for it. They have, I'm sure you've seen the Michael Fox story, and they do have brain surgery for this, where they implant these electrodes in your brain, and it's called deep electrostimulation. And that may help tremors when the medicines for Parkinson's fail. So there is some surgical treatments for it. And there's a lot of new exciting things on the horizon that may work as well. We'll talk about them in a minute. But the main medicines they treat this with is levodopa. And then they usually add carbidopa to take care of the side effects you get from the levodopa, like nausea. There's also other medicines for it. One interesting one is Viagra, sildenafil. A lot of people use that, and they find that they're much less dependent on their levodopa because it enhances blood flow to the brain. So that's interesting, using Viagra for Parkinson's. There's other dopamine agonists that mimic dopamine. Levodopa really doesn't mimic dopamine. It makes your brain produce more. So the dopamine agonists, you think of them, the two most common ones are Requip and Mirapex. Those are medicines we use a lot for restless leg syndrome as well. Other ones, MAO inhibitors, COMT inhibition, anticholinergics, amantadine, the flu medicine. But, a lot of what we talk about is prevention. And it turns out that if you go to any major medical journal and talk about prevention, the main thing really are eating right and exercising. A lot of our health comes down to that, doesn't it? So those are the two main preventative measures for getting Parkinson's in any journal. Any neurologist will tell you that. But there's other things you can kind of do, like eat vegetables, take omega-3s. Of course, vitamin D is always at the top of my list. CoQ10 is very helpful. Green tea extract. Even CBD oil, that's been found to be very helpful for prevention. Even coffee, but exercise and diet, a good Mediterranean diet. There's also something called, so if you get tremors and you're having a hard time with balance, and don't freak out, there's a thing called pseudo-Parkinson's, and it turns out that that's a drug reaction to a lot of drugs. So especially antidepressants, antipsychotics, anti-seizure medicines, anti-vertigo medicines, some calcium channel blockers that we use for hypertension, nausea medications, glaucoma medications. So always have your doctor go over all the medications you're on. Anybody that comes to me with a new symptom, I always say what medicines you're taking, because medication side effects are certainly so common. So what's the future of treatment of Parkinson's? Maybe deep focused ultrasound therapy. They're doing that down at Palm Beach, where I went to my conference on cannabis a couple weeks ago. I think stem cells are going to be very useful, probably to regenerate that part of your substantia nigra that makes your dopamine. So regenerative medicine is the future. A lot of what we study in anti-aging is regenerative medicine. That's what it is. There's besides the vitamins that I just mentioned and diet and exercise, there is one that I use in a lot of patients that feel like they are at risk for cognitive decline. And remember, as you age, your dopamine naturally decreases. So a lot of your cognitive function is related to dopamine, that very important neurotransmitter. And that's called Dopamine. Life Extension makes it. It's really made from wild green oat extract. I've talked about it in the past, and a lot of the patients I put on it, they feel that their cognitive function improves, and maybe their motor movements also. It's certainly not a cure-all for Parkinson's disease, but it's kind of a natural MAO-B inhibitor. So I'll give that to a lot of patients that are worried about it or think they're coming out with a few symptoms of it. But look at their medications first. Talk to them about their diet and exercise. And, we need to pay attention. I think we're going to get more cases of Parkinson's because of COVID-19, because it somehow can enter the brain through that ACE2 receptor through the olfactory tract. That's why a lot of people just can't smell as a precursor to their getting the COVID-19 symptoms. Sometimes it's the only symptom that people have. Most of the time they develop the other symptoms as well. But I think at least 60% of people lose that sense of smell, and that means that it's entered your brain through the olfactory tract. And a lot of people suppose that there is a viral etiology to Parkinson's as well that gets in your brain and inflames your brain. And of course, a lot of the long-haul COVID patients we're seeing have chronic brain fog and fatigue. You look at the Epstein-Barr virus, which causes chronic fatigue. So we need to really focus on prevention, early treatment, keeping a healthy lifestyle, which is more important than any medication you could ever give. But so think about Parkinson's disease. I'm sure you know people that have it. We're hoping for a total cure for Parkinson's at some point in the future, which I'm sure there will be. It may be more along the lines of stem cells. But anyway, Parkinson's disease, all the things you can do to maintain a healthy lifestyle is what we want you to do. Screening is important. So I hope this helps. This is Dr. Tom Rogers at Performance Medicine. I'll see you next week.